Merhaba. 7
Hello.
Nisan Dünya Sağlık Günü
So, as we know, the 7th April, World Health Day, within the scope of the support of World Health Organization Country Office and the Ministry of Health, we have the film festival as Leave No One Behind, and I would like to welcome you all. So we pay attention to the needs of health services and we pay attention to the importance of the healthcare professionals. So we are going to have this story today, the integration process of a dad, a father, and a son. So it's called A New Beginning, and we are going to see how difficult the integration is, and we can see the reflections and the effects on different generations. And today, Mr. Ala Mohsen is together with us. Welcome.
Yep.
And let me introduce you the other speakers. We have Ms. Habibe Özdemir. She has been working as an expert in the Ministry of Health as of 2014, and she worked in different fields and also worked as the director. And then we have Dr. Özge Akyol Faria coming from the EU delegation of Turkey, and she is the program officer in health sector. And for the last 4 years, she has been managing the Sıhhat project from the part of EU, which is also funded by 4 million euros. And we have Bahadır Suçaklı together with us. He started working in 2017 in WHO Turkey office, especially working as a national expert for the emergency responses and also working in the refugee program. And also he has been working in non-communicable diseases and also following some other programs. In addition, he is also working for the WHO migration program, and he is also the director of the project, which is for the access of health and rights for the migrants and refugees. And of course, now I would like to give floor to the director of the movie, because we have different humanitarian dimension and it's really important for all of us. And we have seen Rabiaa and Kaisin, so Syrian dad and child, and there is a new story. They are going to start a new life in Denmark. So first of all, I would like to ask you, how did you meet this father and child? And then how did you follow this story? How did you follow their story for that long time?
Yes, thank you for having me here today. I am a refugee as well. I came with my family to Denmark back in 2000. My father was a political refugee from the Saddam Hussein regime. So for us, it was also a new beginning back in 2000. So I grew up in Denmark as a 12-year-old and until now, and integrating into the Danish society, and also having to struggle with the identity of being Iraqi and Danish. So, but then I started making films and I started documentary films. And when I got educated in 2015, I took my camera and went to a central station. It's a train station in Copenhagen. And at that time in November, there was a lot of refugee walking through Europe, and I filmed many people who came through the station. Many once go to Sweden, Finland, and Norway. But when I saw Rabiaa and Kais, he was in a very difficult situation because he was in a wheelchair. So he attracted my attention, and I went to him and asked him if I could film him. So I started filming him in the beginning. That was for a television program for the Danish television. Later on, when he went to Norway, I kept contact with him and asked him later on if I could follow his journey into Norway. And he accepted that. So that's how it started, because I live in Denmark and he lives in Norway. It's two different countries, but have the same system somehow.
Evet. Peki bu uzun süreye yayıldığını biz
So we know that it goes for a very long time. I mean, normally when you shoot the film, how long did it take for shooting? And how much of it is reflected on the film?
It's different. This was my longest project. It took 3 years of filming, 1 year of editing, so around 4 years. And the reason why we wanted to follow them for that long was because we wanted to see the transition. My own story, when we came, my family, to Denmark, in the beginning it was like we were in a safe place and we were happy about it, to get an apartment, and we started school. But later on, the psychological effect started. So my parents started to have this deep longing for Iraq, because it's so different society from theirs. That's why I wanted to follow them for longer time. As you can see, you have two different experiences. For Rabiaa as an adult who has found his identity in another society, the language. Then when he arrives in Norway, he has to start totally from the beginning. While Kais, he absorbs more easily. And I think from a Scandinavian point of view, this is a really interesting thing, because we, in this Scandinavian society, we always blame these adults, as my fathers and mother, why they don't learn the language as fast as the youngsters.
Evet, çok teşekkür ederim. Biz tam
Thank
da bunu
you.
duymak ihtiyacımız
Actually,
vardı. Yani filmde
that's what I was expecting to hear, because we have seen in the film, but it's really important to hear from the director himself. Now I would like to ask Özge regarding integration, starting a new life, adaptation to a new culture, learning a language. It's a very difficult process. What would you like to say about that?
Kesinlikle öyle.
Definitely, yes. In this film, actually, we have seen that there was a person, devoted, dedicated father. He was ready for all kinds of struggles, all kinds of difficulties. He was providing to give the best for his son. And he is aware that learning a language is very important.
Düzeyi oldukça yüksek bir ülkede.
On the other hand, we have seen the Norway, the prosperity, the services provided at a high level, and then realizing it into their own life. This language issue, actually, this is the issue for the migration cases and also for all the migrants. It's also valid for Turkey. The integration of the migrants, actually, the main element is to learn the language. And also, there is another dimension of most of the projects as learning the language. So it's indispensable, adaptation in the culture and being comfortable in that culture. Yes. And now I would like to come to Bahadır. Mr. Bahadır, Rabiaa had too many operations and he needs to walk once again. It takes time. So what did you realize when you watched the film? I mean, especially for the services, health services provided to migrants. Of course, there is an integration of migrants in the society. There are different dimensions for the accommodation, for the employment, for the schooling, and access to services. So there are different components. Among those components, in the story of Rabiaa, we have seen that, the need of health can be received in within the language and the culture. So this is a very good role for the culture, an very good example for the culture, because you are a stranger and you come to a new country, and this is very important for the integration. And you don't have to be a migrant or a refugee to think that. First of all, imagine yourself, especially if you have a very specific problem, health problem, when you're going to travel. Of course, you're going to have your concerns. Maybe there will be a health problem, and then you are going to think, you are going to have concerns whether you will be able to access the health services. Even if we go to a holiday, maybe you will have some concerns like, if I'm going to have high blood pressure, so am I going to find the doctor? Am I going to find the required medicine? So we see it very clearly. Of course, this person goes to the hospital because he's in need of health services, and then he makes some comparisons. I mean, he makes all those comparisons with his own country, with the transit countries. He has some concerns regarding the services provided. There are some difficulties within the language, but then after overcoming these language problems, then he was in a wheelchair, and then he solved some of those problems, and then he becomes stronger, and we can see that he enjoys walking. It was not like a problematic case going to the hospital. I mean, we can feel that in the film. And in addition to all services, we can see that there should be an alignment for healthcare services with language and culture. And this shows that there could be peace and prosperity among the host community and the migrants. So this was a very good example in the film. Thank you very much. You explained it very well. Ms. Habibe, of course, we have Syrian migrants in Turkey, and there are some services provided to those migrants, adaptation processes for those. Of course, there are very major traumas. There are different health problems. There is also another trauma, you know, the wife left him, Rabiaa. So I'm sure you have come across with different examples. Maybe you can give us some examples, general examples, or you can explain the general picture in the country. Especially for migrant health, I've been working for the last 5 or 6 years, and every day you learn something new. You start the day with something new all the time. And within the scope of the project, we work closely together with healthcare professionals. And, you know, we have professionals, healthcare professionals from Syria, and we have all those Syrian healthcare professionals, and they're our colleagues now. We work together with them, and they provide services to the migrants, I mean, to the individuals coming from their own country. So we have seen that cultural barrier, it's very significant while you receive the healthcare services. So we have also applied all those in our project. And among our workers, we have the individuals injured while escaping from the war, or leaving their kids, or we have some individuals losing their wives, husbands. So we had been meeting with them, and we had contact directly with the patients. As you have stated, there are physical wounds, injuries, but on the other hand, there are also psychological injuries, damages. So there are much more sometimes.
Bizim hani sistemimiz içerisinde
and in our system, we try to eliminate culture barrier, language barrier, and we try to provide healthcare services as the Ministry of Health. And Sıhhat project is one of the providers, facilitator, clearing the path for all those services. And also, this was an opportunity to provide much more comfortable healthcare services. These are very good works. Now I would like to come back to Allah. You know, there is a difference between the generations. It's very striking. But then we have realized the kids started speaking Norwegian very well. So he adapted very easily, and he was like the helper, supporter of the father. I mean, there was a reverse. The father becomes the kid becomes the father. So could you please share your observations, your reflections? I mean, could you elaborate that relation?
Yes, I think Kais is a really bright kid, I think, because they have been through difficult experiences. So somehow I think kids can grow up faster than normally. So I think Kais had a feeling of that he and his father was alone. So he had this kind of responsibility for his father sometimes. Also, as my own experience, we had this gap between generations. So in many years, we translated many official documents for our parents. So you have the language advantage as a kid for your parents, and they rely on you, and that changes the how can you say, the status or the different here, yeah, because you have to translate for your parents, and that's the same for Kais. Even that he's so young, he still translates for his father, and sometimes his father can misunderstood some cultural things, and so Kais like having this responsibility to clarify it for his father, for example. Also, there, of course, there is this, he knew that his father was injured, and the dream for every kid, for Kais, was that his father could play with him. And we see that in the film. Also, I think one detail that is not unfolded in the movie is that Rabiaa waited around a year before he could get a surgery, because he needed to get the residence permit first, then later he get the access to the health system. So it's not that everyone can get to Norway or Scandinavia and get these health benefits. So you need to be accepted as a refugee and get the resident card before you get access to these. So he waited a long time before he got his surgery.
Evet. Yani tam ben bu
Yes.
noktada
Actually, I would like to ask Habibe at this point. In our country, actually, we have a smoother, easier system within the scope of Sıhhat project, because if there is a health issue, there's no need to wait, and I can understand that all the services are provided easily. Yes, within the scope of Sıhhat project, we provide primary healthcare services, and we provide support for primary healthcare services. At the same time, Republic of Turkey government provides support for the secondary healthcare services. I mean, there could be some places you can directly apply to receive health services. You need to have your ID card. That's enough. Then we have a very easy functioning system in terms of healthcare services in Turkey. And at the same time, there are some psychosocial support, right, for all those students. Could you please elaborate that for us? Could you explain that for us? Yes, we have migrant health centers So we support all those migrant health centers within the scope of Sıhhat project. We have the personnel, psychosocial workers, psychologists, the kids. I mean, we provide services for all those migrants traumatized, the kids, the mothers. There could be severe cases. If there will be more severe cases among those patients, we have different mental health care centers partially supported by our project, so they can apply to those centers. Of course, there could be sometimes the need of hospitalization, then they're able to apply to the hospitals and they can receive the services in all the hospitals in our country. For our listeners, watchers, we have the primary healthcare services, secondary healthcare services. I mean, how those migrants benefit from those services, it's really, maybe it cannot be clear. So maybe we can explain it more within those within the scope of those projects. Could you please give some examples? For example, similar ones, similar ones to the relation of the Rabiaa and Kay in the film. Of course, there are different concepts in this field. I mean, there are different concepts, terminology in the field of health. So sometimes we cannot express with different words. But when we talk about the healthcare services, there are different levels. For example, primary healthcare services, the first one. And we provide services within the scope of Sıhhat project. We have family practitioners, family physician centers. We have health community centers. So all those centers, they are all included for primary healthcare services. So these are the places which are the closest points for us, the closest centers for us. So you can easily reach the nurse, the physician, you can share your complaints with them and you can receive rapid responses. So we can name all those centers as such. And we have the Syrians in Turkey and we have migrant health centers for them. I mean, these are all included within the scope of Sıhhat project, which is funded by European Union. And within this process, we have Syrian physicians, Syrian nurses, and we have some other personnel working together, knowing the language. So we have different centers at the level of primary healthcare services. So a Syrian can go to those centers and there will be the Syrians and these people coming from the same culture. Actually, this is like, at the same time, like a sorrow, but at the same time, the reality. Because, the Syrian migrants are welcomed by Syrian healthcare workers. I'm a physician, medical doctor. So I can understand this can be a problem for a migrant because this person will not be able to perform his profession in his own country, but then he can provide all those services to his own community, to the Syrians in our country. But there could be different problems, as in case of Rabiaa. For example, the person should go to a hospital or should receive the opinion of a specialist. So this person can go to the public hospitals in Turkey, and Syrians living in Turkey can apply to those hospitals. All the routes, all the paths are clearly defined for Syrians, so they can apply to the public hospitals and receive the services. And language barrier issue. Yes, we have cultural language barrier in hospitals compared to these centers because we do not have Syrian physicians, Syrian healthcare workers in hospitals, but we have the leading guidance personnel because they are also coming from the same culture. These personnel can support the patients in those hospitals. And similar to the example of Rabiaa in the film, because I don't think that translator is a Syrian. I'm not sure, maybe I did not understand it well, but So we can see the personnel guiding those patients at 2 different languages. So they help them for finding their ways, for communicating with the physicians, clinicians. So this is an integrated process. And similarly, of course, we have stories in the field of health in our country. And also kids, they are the supporters of all those healthcare services. You know, we are in the middle of the crisis, and most of the kids, they learn Turkish because they grow up in this community. They go to school, and we have a high rate of enrollment. They learn Turkish, they learn easily, and they take their parents, they take them and bring them to the hospital. So they support them because, you know, the health information, it's more sensitive. Even if we have supportive personnel, transferring that knowledge to the patient or to the healthcare worker, you need a different sensitivity. So kids, they minimize that element of language barrier. So they are helping their parents as supportive individuals. And Miss Özge, let's expand our conceptual framework, starting once again, a new beginning. And our theme is a new beginning. And of course, people escape from different places in very harsh conditions. We always think of Syrians, but there are some other places, and they would like to reach the European countries. They would like to start from Turkey, and they would like to reach European countries. So this was the flow. And of course, we don't have the happy ending as Rabiaa and Kais. And also there was another happy ending as the family of Ala Mohsen. So how can the governments can be more open? How can those states embrace those migrants? Actually, I don't want to give my answer away from the film. As we have seen in the film, you know, all those migrants, they cannot be so lucky as the father and son in the film. As we realize that irregular migration, irregular routes, maybe they had a very dangerous journey and they migrated to Europe through Greece. So the journey was in 2015. In 2016, there was an agreement signed between European Union and Turkey on the 18th of March, and this was related to migration. And you know, we have also the FRIT project, which is the facility for the refugees in Turkey, and there was a fund, 6 million euros for Turkey, and this was for preventing all those irregular routes, irregular migration, and to provide good conditions for Syrian migrants. Therefore, as of 2016, actually, we are in a very intensive effort and work. You know, we're talking about a huge figure, 6 billion euros. First of all, we give priority to education, health, municipality, infrastructure, humanitarian aid, migration management. For all sectors, we try to provide support, and totally 780 million euros was used for all those projects. I don't want to go into the details, but of course the final objective is, as in the movie, to provide all those conditions in a best manner and to contribute to the economic prosperity of the country. How can I say? So we are talking about 3.5 million individuals. So, you know, we call it like a burden. Actually, this will not be like a burden, and we will start to see this burden as an opportunity, because I'm in the health sector, but also in other sectors, we pay attention to employment, and there are various professionals. So Syrians can also work in different professionals. So there are different projects where we can provide those opportunities. For migration concept, this will be an opportunity rather than a burden for Turkey. But unfortunately for other countries, when we look at the recent elections, we can see the candidates against migration, they are voted. And we can see actually they get the votes from the societies not living together with migrants. For example, we can see some of the states not giving votes to Trump. They live together with the migrants. Actually, first, it is understood that migration is not a threat. This is understood by the host communities and also for the governments. So this is something very hopeful, but we are at the level of that. That's why I'm very pleased. Thank you very much. So, Ala Mohsen, are you aware of the conditions in Turkey? I mean, the conditions of the migrants in Turkey, the services provided to the migrants, refugees in Turkey? And maybe there is another neighbor. I mean, you know, you have different opportunities in Western country. And so in terms of individual happiness, in terms of cultural feeling closer, what would you like to say us?
I'm sure, but I'm not aware about how the conditions are in Turkey that much, so I can't say anything about it. But can you maybe what was your questions that maybe you can ask again to just be...
Siz mesela
For example, you live in Denmark, you migrated to there, so you grew up in Western country.
Yes.
Opportunities. But in our country, you know, they live in a place where they are closer to their own culture because, you know, Syria and Turkey, they are neighboring countries.
Yes.
So where will you stay happier? I mean, are you feeling happy in Norway, or are you going to be happier in Turkey or in a country which is closer to your own culture?
See, it's a really good question. For my experience is that I have been through that. So now Denmark is my home, but it wasn't not that painful. I can tell you about an experience. Before we came to Denmark, we lived in Syria for some years. And when I came to Denmark, I was 12 years. I remember that was the first time I saw snow, and the city, a little city in Denmark, was so empty. So I and my sister, we started crying. We asked our parents, let's go back to Syria. We don't want to be there, because for us as kids, we were not focused on the materialistic opportunities or the safe. We were really much cared about where we felt home, where we were used to say hi to everybody in the streets. And Denmark was a totally different culture. Though I think for some of the adults, it's really hard to come up to Denmark or to the Scandinavian societies, because they are very reserved. People are not that social, and it needs a lot of times. Even for people who come from the United States, they have difficult getting integrated into the Danish societies, because they are not that social as other cultures. So that part is really tough for many adults and immigrants. And I think I could imagine that that some countries that are closer to their home countries, they will feel more home there. And I know also some Syrians who got residence permit. They went back to Turkey because they couldn't. They didn't what do you call it? They didn't like the life of Denmark, so they missed the life that are much more closer to their life. Long answer, but yeah.
Evet ama güzel bir yanıt verdin.
Yes, but it was a very good answer. So Rabia, you know, Rabia stayed alone just for a second. And then when we realized that it was more difficult for him to be adapted, I mean, adaptation was more difficult. So I've been in Norway for 4 times, and they live in small villages. You know, the population is like 2,000, 1,800. You know, the life is itself isolated. So, you know, they don't live very close to each other. I mean, we have very crowded families. You know, they are not like our communities. For this reason, you know, you understand the feeling, the case of Rabiaa and Kaiser, because a new beginning, you know, it's more very promising. And so it's like the connection of Western and Eastern of the world, and also harmonizing all those 2 cultures. I see that in the film, but on the other hand, I was a little bit sad. So for the future, maybe you can say something, especially in integration, in this migration. What do you think? So then we will conclude for the future.
Yeah, I just want to say one thing is
Bir şey
that,
daha söylemek.
oh, was it for me?
Please.
Oh, yeah.
Waiting for you.
For many years there were no any Syrians in Scandinavia. You know, very few. You know, very few. So of course I believe that people fled because of the war. Many Syrians it was a really beautiful country. The climate is like Turkey. It's really nice, and people had some places simple life, but they were happy about it. So unfortunately it was the war that forced many people to flee. So for my parents, when we come to Denmark, they dreamed about going back for many years. So many immigrants, they really have this belonging to going back to their home country, because they feel they will thrive much better there. Though the future, I think it's difficult to answer about the future. The positive news, like also about the Syrian, is that many of them comes from Syria was safe, but also you have many well-educated people, or people who had skills. So in Denmark, we have it's one of the toughest countries in the world in politics against refugees. So in many cases, if you're not from Denmark, you will say it's a racist country. But you had many Syrians who entered the working force somehow much more easily than my own parents who flee from Iraq, which was a field of war, or a country like Somalia, because those countries was very much damaged. So in the municipality in Copenhagen, you will find a Syrian engineer, and that's a really big job to get as a refugee. And the lower working force are driving food delivery, and many of them are Syrians. So there is really positive stories in Denmark, even that you have many anti-immigrants laws.
Evet. Peki çok teşekkür ederim.
Okay, thank you very much.
Thank you.
So we're at the end of our talk. Now I would like to ask Özge and Habibe. So, a new beginning for the future. What would you like to say related to this issue? Miss Habibe?
Özgen buyurun lütfen.
Miss Özge?
Ben de size
Okay, I was giving floor to you.
Alin Hanım tam olarak biraz daha spesifik sorabilirsek.
Could you please ask more specifically? Actually, I just want to receive your message for the future. I just want to end our talk with your message. It could be a realistic message. It could be an hopeful message or a promising message. We are not pessimistic, but you know, we have the reality of our world. From your point of view, how will it be possible to make a new beginning? Actually,
Süreçte çok olumlu
within this process, actually, it's really difficult to be positive. We are in the pandemic conditions, and we know we experience it globally. This is also valid for our country, and
ciddi bir
we have a high population for Syrian migrants as 5% of the population in our country. And we can see that the population is 450 million in European Union. And then when we compare these figures, you know, there is an imbalance. The economic collapse, pandemic, that's why I cannot express myself in a very optimistic manner. But as I have stated, I hope migration will not be a sad story. I hope the main problem, the war, will be stopped. Solving the problem of migration, making migrants comfortable, integrating migrants. Actually, it's not a very major problem. The root cause should be solved. I hope the future will be very good after solving all those problems, and especially we know that the Syria crisis continues, and 10 million of Syrians were forced for migration, so we could not close our eyes as the individuals in this world. So that's all from my side. Miss Habibe, from the point of Turkey, you know, it could be the reality, or where would you be for the new beginning? I would like to be more optimistic because we need to motivate ourselves. Of course, you know, if there will be something negative, then at the end, you are going to see the light at the end of the tunnel. So we have our hope. We are hopeful. And of course, we wish all those wars will be ended. And in addition, we experienced this war just next to our country. For this reason, I agree with Özge. You know, European Union has the population of 450 million, and they do not share this 5% population with Turkey. Regarding the future, I would like to be hopeful, but on the other hand, you know, I have a son at the same age with Kaiser, so I hope everything will be very positive and good for us. Okay, once again, I would like to thank each and every one of you, Bahadır, Ala, Mohsen. So connecting two different ends of Europe and the world. So this was the aim in all those talks. We are not going to leave no one behind. So this is the end of our talk for today. Dear So you can follow all the films from the website address of Festival Scope. Thank you.
Very much.
Thank you. Have a nice evening. Thank you.
Uh,
Thank you, Allah Mohsen.